Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have real power, real control, and so that you can influence decision making even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered the second part of this question: how can I be prepared, be mentally strong, and be well positioned for a family meeting with the intensive care team? You can read and access the second part of the question here. If you want to read the first part of the question too, check out the links below this video. In this week's episode of Your Questions Answered, I want to answer another one of our readers' questions, and in this week it's Lorna from Columbus, Ohio in the United States, and she asks, what are the options for my mother in intensive care if she has been ventilated with tracheostomy for about 3 weeks now? Lorna writes, "Hello Patrick, I'm reaching out for info and help. I'm desperate for any advice you could give. Info in the United States is hard to come by. My mother is currently in the ICU at a university hospital and has been for 3 weeks. She is tracheed and they are having trouble getting her off the ventilator. Sepsis is what sent her to the emergency room, at which time she was admitted and later went into respiratory failure. They're not planning to release her yet, but I'm terrified for what the future could hold for us. We have a weaning facility here in town where I understand she will be sent after release from ICU. In the tragic event that she's unable to be weaned from the ventilator, they are saying she will have to go to Nebraska to a long-term ventilator care place. Nebraska. I'm terrified. My mum, our family, lives in Columbus, Ohio. I absolutely, under no circumstances, will ship my mother off to a different state where she will be a number in a bed, too sick to breathe on her own. Can you imagine how devastating that would be to someone who's already in the grips of the most awful event of their life? I'm in desperate need here. I can't find any alternatives as of yet, and I'm just sick with fear every day. I can't even keep food down at this point. I need to know what we can do. Something else that might help is that she is on the Medicare Medicaid system here in the US. I'm just so sick with all of this. Please help. Thank you, Lorna." Hi Lorna, thank you for your email, and I wish you and your family a happy new year. I appreciate you reaching out for help, and reaching out for help is often the first step in the right direction. I can understand your frustration with the system, and I can understand that you and your family are feeling like the health system isn't treating you and your family like you should be treated. It sounds to me as if the intensive care team are trying to take the easy way out. I know it's easier said than done, but panicking is the worst thing to do for you and for your family, and of course for your mother as well. Also, 3 weeks in intensive care on a ventilator with tracheostomy is not a particularly long time for somebody the intensive care team may consider a long-term ventilated patient with tracheostomy. So putting things in perspective is very important for you and for your family. Generally speaking, somebody who's considered a long-term ventilated patient with tracheostomy would not fall into that category after about 4 to 6 weeks in ICU. My first guess, without knowing much about the intensive care unit that your mother is currently in, is that the intensive care team will be trying to send your mother out ASAP for a number of reasons, and I will address those reasons later on. First, let's look at the things that you can control in your situation. Often, a lot of time and energy are wasted by worrying about the things that you can't control. Number 1. You can't control the intensive care team's positioning at this stage. However, you can control your positioning that will counteract the intensive care team's positioning, and that may buy your mother crucial time, and it may increase chances for your mother to be successfully weaned off the ventilator. Number 2. You need to also quickly educate yourself about intensive care and long-term ventilation with tracheostomy. as generally speaking there are unique challenges that go hand in hand with the stay in intensive care and ventilation with tracheostomy. As I have said, 3 weeks in intensive care is not a particularly long time, especially with ventilation and tracheostomy, and it would help if I knew how long your mother had the tracheostomy for and how long your mother has been out of the induced coma. As far as the intensive care team's positioning goes, it sounds to me like the intensive care team wants to send your mother out ASAP for a number of reasons. Number 1. A long-term ventilated patient with tracheostomy can be considered as a bed block, and the ICU therefore is unable to admit other patients that are generally competing for scarce, precious and expensive ICU beds and staff. Number 2. A long-term ventilated patient with tracheostomy may not be seen as a patient that is financially viable for the intensive care unit, and that's generally irrespective whether patients are on a government scheme, like in your case, or a private patient, as intensive care units generally make their money from shorter stays. Number 3. Your mother may not fall in a category where the intensive care team has a high interest in continuing her treatment. For example, you've mentioned that your mother is in a university hospital or university ICU, and university hospitals are generally speaking doing a lot of research, and they therefore may prefer treating other patients first that fit some of their research criteria. I know that some of it sounds very harsh, but it's the unfortunate reality in some ICUs, and it's important that you have an awareness of it. Your job is to ask difficult and challenging questions to the intensive care team, because that is when you start having control, power and influence. I furthermore have sent you some reports that will quickly educate on the topic of long-term ventilation with tracheostomy in intensive care. The reports I have sent for you are: follow this proven system to avoid the 3 most dangerous mistakes you are making but you are unaware of if your loved one is a long-term ventilated patient with tracheostomy in intensive care. And the other report I sent was 6 answers to the 6 most frequently asked questions if your loved one is requiring ongoing mechanical ventilation with tracheostomy in intensive care. Those reports should help you as a starting point, and just by learning some of the things in the reports will shift the dynamics that you will have with the intensive care team, and you will increase your level of control, power and influence. Please contact me again if you need any more help or if you have any other questions. Thank you. And how can you leverage your level of power, influence and control further whilst your loved one is critically ill in intensive care? You'll get to that all-important feeling of power, control and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to get real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Our free report helps you with in-depth insight that you must know whilst your loved one is critically ill or is dying in intensive care. Sign up for your free membership now and download your free instant impact report. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you'll also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You'll get that crucial behind the scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's episode of Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.